Hi, today's topic is GERD or GERD. There is no word called GERD, but it's actually GERD, Gastro Esophageal Reflux Disease, or simply you can say acid reflux or even heartburn. It's very common, and it's all in the previous videos you would have seen. Usually we say there is a food pipe, then there is a junction, then there is a stomach. So this junction is actually there is a sphincter. The sphincter is it's not an involuntary sphincter. That means we cannot control the sphincter, which is directly connected to the brain, which can control the sphincter tone. So when the tone is lost, the contents in the stomach, it could be acid, it could be bile or digestive enzymes or digestive juices, even food, they can come up. So when they come up, this neutral area, when it gets the acid or bile, it gives you heartburn. So heartburn is not a heart attack, but it's kind of acid reflux. Why it happens generally? As I earlier told you, it's an involuntary muscle which is controlled very directly with the brain, through the vagus nerve. So when you are stressed, when you are depressed, when you are in a kind of stressful time, these sphincters can open up. So when they open up, things come up and they can cause symptoms like heartburn. The other way, suppose somebody has too much of acid or they have an ulcer disease. Again, this tone loosely lost. So again, acid reflux can come. And very importantly nowadays, obesity. The more you gain weight, the sphincter loses tone. When the tone is lost, again acid reflux. And any intraabdominal pressure increase, generally suppose even normal times, in pregnancy is very normal one. Even when the child grows, the pressure increases, it pushes, again the sphincter can open and acid reflux can happen. Or any other intraabdominal pressure because of some tumor, some huge tumor, or some people, ascites, all these things, when the intraabdominal pressure increases, or those who are doing stressful or heavy work, when the pressure increases, acid can reflux back. So GERD or GERD or acid reflux or whatever it is, it's a very simple disease, and how to diagnose is usually the surgeons will ask some questions and examination, followed by they may ask for an endoscopy. Endoscopy can easily tell us whether they have a GERD or not, and also they can tell you the reasons why GERD. And apart from that, they may sometimes ask for the 24 hours pH monitoring. So what is the pH? They will measure. Otherwise, there are other tests like the manometry, the pressure, tone. All these things can come to a conclusion for the GERD. And what is the treatment? The first is lifestyle modifications. This is 95%. If in spite of lifestyle modification, if it's not get cured, then probably the surgeons may add PPI or some other drugs to prevent the reflux. If both medicines as well as lifestyle is not working and it's really disturbing, then there are other options like surgery. So, but GERD or the GERD or acid reflux is very common disease which can be easily controlled by lifestyle modifications. If not, the surgeon can help you. Thank you.